let's get right to it. You might think you're past the point of worrying about embarrassing bodily issues, but the truth is that once the clock ticks past 65, your body can throw you some shockingly unpleasant surprises that no one else has the guts to talk about. You know that polite nod and forced smile your family or friends give you when you lean in close? They're noticing something, and I'm going to say what everyone else is too nice to say. It might be your hygiene. That's right. Personal cleanliness isn't just a young person's issue. In fact, ignoring it at this stage can push people away faster than you realize. Today, I'm laying out 7 unforgiving realities about embarrassing hygiene problems after 65, not to shame you, but to wake you up to what might be happening behind your back. Brace yourself, because some of these points are going to sting. But if you stick around until the end, you'll learn exactly how to address each and every one of them so you can hold on to your dignity and self-respect for many years to come. Because trust me, nobody wants to bring this up in family dinners or casual get-togethers, but this is the information that could save you from even more awkward moments. If you've got the courage to listen, I've got the brutal truths to share, and I promise you're not hearing this anywhere else. First, let's discuss an unspoken problem that creeps up on many older adults. Persistent, lingering body odor that feels like it comes out of nowhere. Yes, your body chemistry really does change, and it's not just about sweat. Hormonal shifts, changes in skin pH, and even certain medications can produce new or stronger odors that you may not even notice because you get used to your own scent. But guess what? Your grandkid who refuses a hug, or that neighbor who barely leans in when greeting you, definitely notices. And the awkward part is, nobody wants to tell a senior that they smell off. They'd rather just politely avoid standing too close. The solution here starts with humility and awareness. Try switching to a pH-balanced soap, and consider adding an antibacterial agent if you suspect infection or excessive bacteria buildup. Launder your clothes more frequently, especially if you're prone to sweating or if you use multiple layers that trap odor. Hydrogen peroxide can help remove stubborn smells from clothes if a regular wash isn't cutting it. Don't be afraid to ask someone you trust, "Do I smell fresh?" Because you might be the last to know. When you sense that friend or family member turning away slightly, it's time to reevaluate your bathing routine. And if you're physically challenged with showering or bathing, there are in-home support services or simple modifications like grab bars that can make washing regularly a lot safer and easier. Think of it this way. If you're motivated enough to watch what you eat for your health, be just as vigilant about how you smell for your social well-being. And if this makes you squirm, good. It means you're hearing the uncomfortable truth. The second issue is what I call the hidden breath bomb. Yes, I'm talking about the breath that can clear a room the second you start speaking. A problem that's more common than ever once you hit your late 60s. Due to factors like dry mouth from medications, gum disease, poorly fitted dentures, or simply neglecting your dental hygiene. You may not realize it, but chronic bad breath can become so severe that people will do anything to avoid a chat. The fix here includes more frequent dental checkups, flossing daily, and using specialized mouthwashes or rinses that target the bacteria in your mouth. Don't ignore that dryness you've been feeling. Ask your doctor if there's a way to address it. And if you have dentures, Clean them meticulously at least twice a day, because food particles and bacteria can turn them into a breeding ground for foul odors. Then, after a good cleaning, do a self-test, cup your hand over your mouth, breathe into it, and smell. If you still stink, it's time to rinse and repeat. Last but not least, cut down on sugary snacks that feed unwelcome bacteria in your mouth. If you've ever had someone offer you a mint or gum unprompted, this might be your sign that it's time to level up your oral hygiene game. Next, let's confront the elephant in the room: incontinence and urine odors, which can cling to clothing, furniture, and even your carpets without you realizing it. You might try to hide it, but deep down, you know those little leaks are a thing. And while you might be ignoring them, your visitors are definitely not. It's not just about occasional accidents. Sometimes the problem is that you haven't properly cleaned your bedding, couches, or chair cushions where an accident may have happened. The best defense is awareness and preparation. Yes, it might be mortifying to buy incontinence pads or protective mattress covers, but it sure beats having your entire living room smell like a neglected nursing home. Consider disposable or washable seat covers for your favorite recliner. Don't forget that a thorough cleanup with enzymatic cleaners can remove odors from furniture fibers. Check with your doctor to see if there's any physical therapy or medication that could help lessen urinary leaks. Also, watch your fluid intake, but don't stop drinking water entirely to avoid accidents. Dehydration can lead to more concentrated urine that smells stronger. If you don't take this issue seriously, don't be surprised if house guests find reasons to cut their visit short. Protect your dignity by making sure your home is a place people want to stay, not flee. Fourth on the list is that dreaded buildup of grime behind the ears, in the belly button, or in other forgotten crevices. Yes, I'm going there, and it's not pretty. As we age, mobility issues can make it harder to scrub certain areas thoroughly. Plus, our sense of touch and smell might diminish, so we might not notice that behind-the-ear cheesiness or that belly button crud that releases a stench the moment you lift your shirt. The result is a pungent body cheese that nobody wants wafting nearby, but everyone pretends they don't smell. The quick fix is a systematic scrubbing routine. Set aside time to carefully wash those neglected spots with a mild soap or body wash daily. Use a soft washcloth or gentle sponge on a stick if your arms can't reach. Also, routine skin checks are vital. If any area is red or particularly smelly, it could mean you've got a yeast or fungal infection going on. Don't assume a quick splash in the shower does the job. Take your time. And if you can't do it alone, see if you can arrange a nurse or home health aide to help once or twice a week. It's worth the minor embarrassment of asking for help if it means you can be confident you're squeaky, clean, and odor-free in places you never used to think about. The fifth brutal reality is more visible, but no less mortifying: fungal infections in the nails and feet. I'm talking about that thick, yellowed toenail that you've been ignoring, or the constant itchiness between your toes that's been passing itself off as a minor nuisance for months now. Left unchecked, these issues can lead to some foul smells and even rotting nails. Now, if you think you can hide that behind socks or closed-toe shoes forever, you're only fooling yourself. At some point, you'll want to visit family or have to take your shoes off at someone's request, and the reveal can be traumatizing for them and for you. The solution is to see a podiatrist and get a handle on the problem before it worsens. There are antifungal creams, medicated nail lacquers, even laser treatments that can help clear up infections. Don't shrug this off as merely cosmetic. Advanced fungal growth can lead to real pain, difficulty walking, and further infections. Make it part of your routine to thoroughly dry your feet after bathing, change socks regularly, and rotate your footwear to let them air out. And if the thick nails are too stubborn, you may need a professional to cut them safely. Neglecting your feet can send a disturbing message that you've given up on self-maintenance. And trust me, people notice these details more than you realize. The sixth problem we need to talk about is stale clothing syndrome. When you don't realize that your favorite sweater or pair of trousers retains a strong odor of sweat, smoke, or just general mustiness that you've grown accustomed to. Because your sense of smell might not be as sharp anymore, you might rotate the same couple of outfits, unaware that they're screaming, "I'm not clean," to everyone around you. That foul wardrobe aura can cling to you at social gatherings, making people withdraw without saying a word. The fix is straightforward. Schedule regular laundry days, and if you're struggling physically, pay for a laundry service or ask a trusted friend or family member for help. Use odor-neutralizing detergents and occasionally wash your clothes in hot water, if fabric permits, to kill bacteria. Don't hang your clothes in a damp closet, and if you smoke, consider stepping outside in a designated jacket so you don't soak all your indoor clothes with smoke stench. Air out your wardrobe occasionally, check if your drawers or closets smell musty, and place moisture absorbers or odor-eliminating products in them if needed. People often think that poor hygiene is limited to private bodily issues, but a stinky shirt can be just as off-putting as body odor. Finally, the seventh harsh reality is persistent scalp and hair odor, something we rarely talk about. As you age, the scalp can become oily and prone to bacterial or fungal growth, especially if you don't wash your hair as often, or if you rely on dry shampoos or quick rinses that never really cleanse the skin beneath. That old hair smell is a real thing, and it can hover around you like an invisible cloud if you don't address it. Additionally, if you wear wigs or hair pieces, they can trap sweat and bacteria, leading to an even stronger odor that you might be oblivious to. The solution? Wash your hair thoroughly with a gentle shampoo at least a couple of times a week, even if you think you don't need it. If mobility is an issue, see if you can purchase an inflatable shampoo basin or ask for assistance. Pay special attention to rinsing out all the product so it doesn't build up on your scalp. For those wearing wigs or hair pieces, wash them regularly according to the manufacturer's instructions and let them fully dry before putting them on again. A clean scalp not only feels better, but it also prevents that noxious, unwashed hair aura that can creep around you. Now, if you're still here, congratulations, because most people would have tuned out at the first mention of personal odor. But if you're serious about maintaining both your self-respect and your social relationships, you need to take these 7 points to heart. Nobody wants to be the one avoided or ridiculed in hushed whispers. But that's exactly what can happen if you don't get a handle on these hygiene issues. Don't wait for someone to stage an intervention. Be proactive. Ask for help if you need it, and commit to a routine that keeps you fresh and welcoming. Being older doesn't mean you stop caring about what message your body sends to the world. Because, let me tell you, people might not say anything, but they sure can smell, see, and remember the unpleasant experiences you unintentionally share with them. If you found this brutally honest list helpful, hit that like button and share your own experiences in the comments. Type your hard truth if you've ever had to confront an uncomfortable issue like one of these, and don't forget to subscribe for more no-nonsense insights on the parts of senior living that everyone else is too polite to discuss. You deserve the facts, and I'm here to give them to you unfiltered. Face these realities head on, and you'll find that not only does your own confidence improve, but the people around you will be a lot more comfortable and open in your presence. That's the power of honesty and good hygiene. Two things that might make the difference between feeling isolated and feeling truly included. Take charge and keep living with dignity in every aspect of your life. Nothing less. End of story.